So thank you very much, everybody, and good day, good afternoon, good evening to all of the ADI family, wherever you are. Welcome to the Oval. Today we are in this wonderful venue, the Oval in London, a place that is very important for all the nations that play cricket. Cricket, it's a beautiful sport to watch, primarily because people play it in incredibly cool sweaters, which we Italians find irresistible. And because all of the spectators are fed strawberries and cream, which I find enormously civilized, if a tad fattening. Yesterday also somebody told me to mention gin and tonics, but we have a session on risk reduction, so I'm not going to do that. Despite 30 plus years of living in the UK, I still don't have a grip on the rules of the game. The first lines of the rules of cricket explained to a foreigner read, each man that it's in the side that it's in goes out, and when he's out, he comes in, and the next man goes in until he's out. So lots of ins and outs and ins and outs. At times, it reminds me a bit of us at ADI and of our member nations. As you have heard in some of the videos that we have read and some of the interventions that we have listened to, particularly Helen, despite all these years of advocacy and working so hard on dementia and working from the inside with so many governments, we are still very much the outsiders here. And apparently I had a slide, there we go. But I digress. We are not here to talk about cricket, are we? In my opening address, I called you all a family. A family, this is what we are, and have continued to be so throughout COVID, throughout thick and thin, helping each other, learning from each other, sending ourselves hugs and encouragement, and overall continuing our difficult task of believing in a better world for people living with dementia and for their families. All of you, wherever you are and whatever you do to advance our cause, care deeply about those who are most vulnerable in society, and I salute you all. It is your joint effort that makes us strong. And just as an example of that strength, here is a story. When I was first drafting the version of this speech, it was just at the beginning of the awful Ukrainian conflict. And we all know how Ukraine, as many of our member countries, Tonga, Yemen, Syria, and Venezuela, to name a few, is going through a terrible period. Our Ukrainian associate, Irina Shevchenko, had been sending us reports of the terrible choices families with relatives living with dementia were having to make. Irina will be speaking at this conference later today. At that point, it was amazing to see the incredible amount of offers of hospitality and assistance of our European members. But even more astounding was to receive an offer of help from Marie McCabe, the CEO of Dementia Australia, who informed me that they had help cards and materials available and ready in Ukrainian. Of course, you know, from Australia in Ukrainian. Because in our world, everything is possible, and help is always at hand. And when Ukraine was looking for help with essential dementia medication, it was America that stepped up to the plate, an American charity in the WHO's network that supplies medication aid. For us at ADI to be there for our members and to connect people and to provide support, spread best practice, and try to make the world a little better every day, this is what keeps us motivated and enthusiastic, even when things are tough and progress seems ever so slow. And I've got a lot of papers here. You know, it is a privilege and an honor to give the first keynote speech at the ADI conference. But it is also a great responsibility, as customarily it charts the path of our organization and what we will do in the next few years to achieve our primary objective. The primary objective, I remind you, is to achieve a better life for people living with dementia and their families. But the strategies, both overt and covert, that we will adopt will have a relevance for a lot of those that we advocate for. We listen carefully to your feedback whenever we speak to you or we ask you questions, like in the survey that Helen reminded us of. And we do numerous surveys, but what you tell us helps me, helps the team and the ADI board to chart a path and to prioritize what we do. And let me here pay homage to my great team and my great board, without whom nothing of what we do would be at all possible. Please take a moment to introduce yourself and meet them. They are behind everything that we do. This conference is a great opportunity for us all to meet you all. But prioritizing is really hard because dementia is not easy. And there is a good reason why the WHO's Global Dementia Action Plan, which was approved in 2017, and of which Tarun Dua will tell us more after me, there is a good reason why it has 7 areas of focus. Those are the ones that you see behind me, and the saying that this conference is divided into. To achieve real results, all of those areas should be progressed, and shall I say financed, all at the same time. But this is utopia, because if we look at where all nations are in the progress of the plan, even those who have made the strongest progress and do have a national plan or a strategy for dementia are still lacking in so many ways. In the slide behind me, you can see the situation in each of the 40 countries that we are working with on the What's Your Plan campaign, of which I will tell you more in a minute. Stage 1 is no plan, and stage 5 on the slide is to have an actual funded plan. And as you can see, none of these 40 countries has one. But many governments, even in high-income countries, where the awareness is stronger and the electorate demands solution, make a habit of kicking the can down the road every year a little bit more. Is this what we want? No, it isn't. Here in this room, many of you are carers and people living with dementia. If you live in a rich country, you want solutions, not more empty promises. If you live in a poor country, you would be grateful if the government even considers you being ill and not just a victim of old age, as many still do. We are still too far from getting what we want. But every day that we get dressed up and that we brush our teeth and that we go out and advocate a little bit more, our collective effort does make a difference. Last year, World Alzheimer's Month got 45 million impressions on social media. In 2019, that number was only 900,000. So we know that our movement is growing, and the more it grows, the stronger we become. And that's all the better to negotiate with reluctant or sluggish governments. And our research continues to be groundbreaking. In September 2021, the WHO published an important report where they agreed with the conclusion of our From Plan to Impact report, now in its 5th edition. ADI's conclusion, and now the WHO's, is that globally we are still very far from achieving the targets of the Global Dementia Action Plan, as you can see from this map, where in red are the countries that have a plan, in gray the ones that are still thinking about it, but at least they're thinking, and in pale pink the ones that are doing nothing. And from this chart, now the chart on the left tells you how many plans have been approved since a very long time back, 2015. And that's the mountain that we have to climb in order to meet the targets of the plan by 2025. So it's not looking good. In October, I decided then that we needed a mechanism to accelerate the works for adoption at ministerial level. The targets of the Global Dementia Action Plan give 2025 as a deadline, and I felt that if we allowed the can to be kicked down the road at global level, we would only make it easier for governments at national level to forget about our constituency once again. ADI had to restructure to have the capacity and willingness to do it, and so we did. The What's Your Plan campaign was launched in December. Laura Dabas, our membership manager, asked our members to let us know if they wanted help and assistance in getting their ministry more focused on dementia at any level. And the result was overwhelming. 40 countries, those that you saw in my earlier slide, repeated in a moment, asked for support at one level or another. Low-income countries and high-income countries alike, which we didn't expect. I think I may be one slide behind. There we go. We formed a team led by Chris Lynch, Louise Arterton, and Laura, and started by writing to ministries to remind them of the obligation they had signed up to by signing to the WHO Global Action Plan in 2017, and asking where was their plan. We offered ours and our members' country assistance. Once again, we have seen a lot of solidarity. We must thank France Alzheimer, for example, for their role in Francophone Africa. We involved WHO's regional offices and other regional bodies in providing technical assistance and local insight. Finally, we organized public media campaigns to go to you, the people of that country and then of the wider world, to ask for your help in putting pressure on governments to take action. So far, we have not needed to deploy the media campaign, much as I was super curious to see where it would have landed us. And this is because, by and large, to our surprise, the governments we interacted with all replied rather promptly. And here you can see a few of the letterheads of replies we had. And we have had several meetings. Some of these countries had plans already in development, we just didn't know about it, and we could query what those were and offer our help in honing them with our local organization so that there would be an input of civil society in them. Some asked for our help and support to face what they know is an impending crisis in their country, but they don't know what to do about it. Some admitted that they were not doing anything, but at least agreed to take a meeting to hear more. We will be formally reporting on the campaign in December 2022, 1 year after its launch. So what you see here is still work in progress. However, we would have kicked ourselves if we had not done it and wasted the opportunity that the 2025 deadline afforded us following the WHO's disappointing progress report. And if you were in any doubt that we are the Cinderella of major healthcare conditions, and can I remind you, it's the 7th leading killer in the world, just bring your mind to 2020, when people living with dementia were deprioritized from triage and COVID treatment all over the world, when they were dying in care homes in mind-boggling numbers, 36% in Canada, 41% in Australia. I could go on, and these were the countries that were courageous enough to publish the data. Imagine how many didn't. And that is if we are even diagnosed, because as our World Alzheimer's report found in 2021, the estimated global rate of diagnosis is still a saddening 25%. And all of this against the backdrop of possible connections between COVID-19 and the development of cognitive deterioration. And here are some of the headlines that we received, so there's a lot of interest in this, after we report about it in 2021. It is impossible not to finish this speech without a mention to what is happening globally with disease-modifying therapeutics. Everybody is entitled to their opinion on this one, and so am I. There has been huge controversy on the drug aducanumab, and there will continue to be controversies for other drugs, I am sure. But one thing is clear to me, and that is that people living with dementia globally are being denied a choice which, in my opinion, is their sacrosanct human right. If they don't want to be treated, that's their choice. But to deny a treatment to anyone, and in so doing, in some cases, discriminating certain social classes or ethnic minorities who could not afford a treatment is wrong. Believe me, at some point, me and my family had to make a decision on uncertain experimental drugs. And we decided to go for it. It did not work. But it was our choice. And that was in another category of disease, where hazardous therapeutics have been in existence for a long time. And people have been using them. And science has been refining and progressing them to a point that some now are disease-modifying and saving people's life. Yes, there are risks, but as long as the individual is informed and is in a position to make their choice, those are for the individual to make. Some of you will agree with me and some won't, but I would be remiss if I were not honest about this important point. And in my mind, I can't stop thinking that the reason why payers and regulators seem to be against dementia drugs is that they value our constituency less. Old people, old age disease. Again, I may be unfair, but it is really difficult for me to dislodge that impression from my mind, especially when so many friends diagnosed ask me when the new drugs will be available to them. It hurts to say they won't. And what if these obstacles and skepticism discourages the research and innovation companies that develop a new medicine do? Then what? Who will do research and development? Who will try and find solutions? The governments that cannot even handle care, on which there is so much fantastic research that is not even applied. And actually, it is still sadly true that we could do so much more application of the amazing research that is done in care and in risk reduction. But whilst many high-income countries find research into therapeutics and innovation in pharma really sexy, for want of a better word, they bizarrely don't seem equally attracted to care research. We have published loads about this, but we do need to do more. This is why this year, the World Alzheimer's Report will focus on post-diagnostic support, a small contribution in this vast area of research, but a significant one, as those first few months post-diagnosis are critical to establish and set strategies in place that can help an entire family get through the complex period ahead. And here I'm smiling at Claire, who's been working day and night on the report. Risk reduction, conversely, appeals to many governments, especially in lower and middle-income countries, which find those topics more relevant to their young populations, and who like the discount element of many of those risk factors being also good to tackle other non-communicable diseases, diabetes, heart disease, cancer, and so on. But are these generic messages really helping our community? Or are they drowning dementia under other agendas? Let's take one example. Jill Livingstone Lancet Commission ascertained without doubt the importance of hearing and hence of wearing hearing aids in dementia risk reduction. But have government heeded that advice yet? Is the wider population even aware of the importance of this advice yet? I don't think so. And there are so many other risk factors that are typical of our community only. And after COVID and the anti-vaxxer movement, even I, the eternal optimist, admit that public health campaigning does not always work. But we must not be discouraged, and we won't be. We will continue to go out and brush our teeth and get dressed up and advocate for governments to adopt and scale up those messages, because only governments can make the real big difference that we all need. And if you're here listening to what I am saying, is because you, like me, you know that we must never give up. Our field is making massive, massive progress, great steps forward. You will hear more and more about those throughout our great program. Now, more than ever, love, our sense of justice, dignity, and decency propels us forward. We know that defending the most vulnerable in society is right, and we will not stop until we succeed. Thank you.